in their respective machines, and they compared the results that they got. And there's always variation among lab testing results. There's sort of a standard acceptable variation. And as long as the results from multiple individuals on multiple different occasions fell within those standard variations, then you can say that dried blood spot testing has been validated for thyroid testing and is as accurate as a venipuncture. And so we just found labs that have already done this. Some of them have been doing it for 20 years. And we just made this technology available to people.
Got it. That's awesome, because I used to have to drive like almost an hour out of the way to a lab that would do the right kind of lab test that my doctor needed. And now I can just do it in my bathroom before making breakfast for the kids. And it's so much faster. I'm so grateful that it exists now. And I love how easy it is too with the app. And I'll mention it's cheaper too than I used to have to pay for lab tests. I love that you guys have kind of revolutionized that.
It's fantastic. And, really it was sort of the last area of healthcare that consumers could truly own. I always would give my patients copies of their lab results, but I'd have to explain what they meant, because it's just a list of biomarkers and a list of the results and no explanation. And so while I could share that with them, it didn't necessarily mean they could understand it without an explanation. The way that we have our results and the way that they are, you get exactly what you would get if you had the blood testing done through your doctor, but you additionally get results that explain to you, what is this marker? Why is it important? Why should you care about it? Here's some additional information. So it really supports the consumer in understanding really that last part of healthcare, which is lab testing. Everybody's a Google MD these days, and we have great websites like Harvard Public Health and the Mayo Clinic and Cleveland Clinic have these amazing websites for people to understand medical conditions, but really they couldn't own understanding their lab testing, and now they can.
I'd love to hear your take on that as a physician, because I know for years that was a frustration for me, that in order to get my own blood results, I had to go through a doctor who then had to give me my own. It just seemed like a little frustrating to me for a long time. And I know, at least from what I've read, that you are a proponent of people being very active advocates in their own healthcare. And I think this actually will hopefully go a long way towards fixing a lot of the health problems we're seeing. I am a huge fan of doctors. I love doctors. And I think you won't make it through 8 years of medical school if you didn't truly care about people. But I also think people need to be more involved. Patients need to be more involved directly in their care and understanding. Because I feel like medicine is one of the most important aspects of our lives. Our health is super important. We can't just outsource that to a doctor. But I'm curious your take on that, just of people being like very involved advocates in their own health from the doctor side.
Yeah, it's interesting, and it's definitely, even I started practicing in 2003, and even in the last 15 years, it's changed so much. And if you think about, medicine when I was a kid and my mom would take me to the pediatrician, I think about how it was back then, and it's changed so much. Patients are becoming much more responsible and taking ownership in their healthcare, which is fantastic. I think that the way that the healthcare industry itself is changing, and with the way that unfortunately reimbursement is changing, not just for the patients and the consumers and what their insurance will and won't pay for, but really what they reimburse for a physician's time with a patient is changing. And so the whole economics of healthcare and being able to have a practice and speak to patients in the way you want has changed so much. That's why we see, a lot of functional medicine doctors who take very, very few patients, spend a lot of time with them, but they don't take, insurance reimbursement. Or you see VIP sort of concierge medicine. They limit the number of patients they see so they can spend more time, and they don't take insurance reimbursement. And for whatever that's worth, it's because a doctor's time is not valued. And so they have to see a larger number of patients in their clinic to be able to pay the bills, to keep the lights on, and to keep the medical equipment up to date, and to keep their staff, getting salaries. So there's a give and a take. The reason why I love this type of testing is, I'm going to give you an example. If you have a thyroid condition and it has not yet been diagnosed, and you come to me for a visit and you say, I'm gaining weight, I'm tired, I'm cold, my hair is falling out, my period's all over the place, it used to be regular, now it's, every sometimes 35 days, sometimes 14 days. I can never know when it's going to come. By the way, I haven't been able to get pregnant in the last 6 months. And you come with this whole sort of big basket of complaints. I've got a limited amount of time with you, and I can say, okay, you've just given me symptoms that may be thyroid, maybe an ovarian dysfunction, or maybe we're looking at some type of other cause of infertility. And then I have to say, okay, what testing am I going to do? What testing is going to be covered by your insurance? Because I don't want to just order a bunch of testing and then have you get stuck with a large bill. You won't be very happy with me. And so I take my limited amount of time with you and I figure out what I'm going to test you for, and then you leave and you still don't have a plan and you still don't have answers. You and I then have to get back together either on the phone or in person and discuss the results and discuss what the plan is. Now, for some people, they don't want to come back in. They want it over the phone, but it's kind of impersonal and I may not have time to do it myself. So you may have my medical assistant calling you with those results and what my suggestion is for a plan. If you take EverlyWell and you say, okay, these are all of my symptoms, and you're saying, okay, my cycle's messed up, but I'm also having all these symptoms that may be thyroid, you can quickly do a fertility test. You can quickly do a thyroid test. You may find out that your ovarian hormones are perfectly normal. Your thyroid is completely out of whack. Now, when you make that appointment to come see me and you've got limited time with me, you and I can spend that entire time talking about your results and what the plan is, rather than me having to take the time to figure that out and get back to you. So I think that this allows patients and physicians to maximize the time that they have together. And I think that it just makes the whole current model of healthcare delivery more efficient.
I agree. And that's such a great perspective to hear from your side, because I'm sure that doctors have many of the same frustrations as patients with the reimbursement and some of the problems in the medical system. And like with doctors truly wanting to help people and patients truly wanting to get help, I feel like you have solved a huge gap there. And I'll share in the show notes what I do personally, but we have a mixture of healthcare sharing plus an app called SteadyMD and also you guys. And so I feel like I am very much in control of my health, but I'm working with these amazing doctors who are my partners. And that even that subtle shift of me being able to order my own labs and then go to a doctor having said, like, I did my research, I have these results, can you help me figure out what to do? That's just so much more empowering. And it, I feel like, puts the patient in a position of realizing, like, I'm willing to take the steps to move forward with what I need to do because I've already taken a step. And I think you're right. I think it totally helps both sides of the dynamic so much.
I really do. And I think that once this type of testing becomes more understood, I think once it becomes more sort of mainstream, then I think that it's just going to make office visits so much more efficient. And you think about, just another example would be a diabetic. Diabetics, if they're well controlled, they still see the doctor every so often to make sure that they're not having any issues with their feet or their eyes. But if they're not very well controlled, they have to get testing called a hemoglobin A1C, and it may be as often as every 3 months. It would be so much easier if when they make that appointment to see the doctor, they have those results with them and it didn't require them to go to a lab to get it done. Because I will tell you, I have 2 daughters with thyroid issues. And unfortunately, this type of testing we can't do on anyone under 18. So I still have to do the traditional, make the lab appointment, go to the lab, hope that the doctor's orders made it there, because sometimes they do, sometimes they don't. Then if they're not there, we've got to wait. We got to call the doctor's office. We got to get the lab request sent again. Then we get the blood drawn. Then we go to the appointment. If I could just do my daughter's thyroid testing at home and then just go to the appointment, it would save time, money, effort, energy, and frankly, frustration. So for anyone over 18, they have that opportunity now to be able to do that and save all of the back end of getting to the lab and just get to the doctor with the results.
Yeah, definitely a time saver. And I hope this is okay to ask, but is there ever a potential that it could be done on children as well? Or are there concerns there that prevent it from being possible?
We're always trying to see if we can expand into being able to offer testing under the age of 18. As you can imagine, there's a lot more sort of legal hoops to jump through. There may be some issues of primary custody and who has consent to medical treatment and when does there have to be a notification. So it's just trying to work through some of the legal logistics. It's not that this lab testing would be any different on children. They may have a different normal range than an adult for certain markers. It's just being able to offer it in a safe and responsible manner via the web, the internet.
Got it. That makes sense. And yeah, I could see that with the custody issues and also just with making sure the results are understood. That makes total sense. So let's go a little deeper with the labs, because I know as a patient, until you actually really delve into the research, it can be hard to understand. And you guys solve this problem already, but like when you get a lab result and it just says like abnormal, 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 but you don't know what it means. So from a physician side, can you walk us through what some of the different tests are and what they mean, or like what kind of insight can these give us into our health?
Sure. And we have a lot of different tests to choose from. We have general wellness tests, which are anything from heart health to sleep and stress to heavy metals. We just launched our omega-3 basic and plus, which I'm extremely excited about because, just thinking about health and wellness, and especially thinking about women's health and wellness and thinking about women who are pregnant or who are going to breastfeed, so many Americans are deficient in DHA that being able to see where you are with regards to omega-3 fatty acids, I think is amazing. And this is not testing that typically could routinely be done at an annual exam or a well visit. So we're super excited to be offering that. We have a suite of men's health tests, which men can take that include multiple hormones, or if they just want to check their testosterone level. We have sexually transmitted disease testing for both men and women. And then we've got a very large suite of women's health tests, and they range from doing a complete evaluation of your hormones and looking at the 3 different endocrine glands that can affect a woman's health and wellness, and those 3 being thyroid, ovary, and adrenal gland, to just looking at estrogen and progesterone if you're postmenopausal and you either want to know where you're at since you've gone through menopause, or maybe you're postmenopausal and you're on hormone replacement therapy, but you're still symptomatic. And rather than go to the doctor and say, hey, this is how I feel, do we need to adjust my meds? You could do this testing at home and go and say, hey, this is how I felt, and this is why I felt this way, because look, my estrogen is still really low, so can we please adjust my meds? To fertility testing to see whether or not it looks like your hormones are balanced to ovulate. And then we actually have an ovarian reserve test, which is simply a day 3 FSH level. It does not look at all causes of fertility or infertility. It just is an indirect way to see if you still have a normal amount of eggs remaining. As we get older, our egg reserves go down. When they get down to a certain level, our FSH day 3 levels go up. And so it's a way to see if my day 3 FSH levels are up and they're up consistently, it probably means my egg numbers have dropped, which I think is really important for women, especially if they're thinking about childbirth, delaying childbirth, just getting a general idea of maybe how long they should wait before they go get help if they're not getting pregnant. There's different recommendations based on age, but if you're young and you've got an abnormal ovarian reserve test, that may be a reason to take action sooner than if you're young with a normal ovarian reserve test. So that's our women's health. And then we have some energy and weight tests, which include obviously a full thyroid panel. We've got metabolism tests, vitamin D testing. So again, along the lines of general health and wellness and just inflammation in the body.
I love that. And so if someone is trying to figure out, like, what would be some signs that someone should get something tested? Like, what should someone look for? So I have women writing to me all the time with potential thyroid problems they're trying to figure out, or anxiety or depression, or like stubborn weight gain, these kind of problems. What signs would someone look for about when they should get tested, and how would they know what test to get?
So the first question is, what signs should they look for? It's really going to vary. And that's why at the beginning of this call, we talked about why it's so important to just sort of be in tune with your body and what is normal for you, so that you can recognize when there's a deviation from normal, whether that's in your cycle, whether that's in your weight, whether that's in your sleep, in your skin, in your digestion, whatever it may be. Just recognizing when something is not just, oh, I had a bad day, but this has been going on now for a week or 2 weeks or 2 months. It's not getting better, and I need to kind of figure out what's going on. When you go to the EverlyWell website, you can actually go onto our Choose a Test, and if you click on any test, there's always symptoms that may be associated. So you can figure out what your symptoms are that are abnormal, and then maybe you've got a multitude of symptoms, and as you're going through the test menus, you find that one test that's like, oh my gosh, this is me. This is exactly how I feel. And it can help you understand that that's probably a good test for you to take if you have the bulk of the symptoms that are associated with abnormalities that can be found from that type of testing.